Hello everyone. Today we are going to discuss about the acute and chronic low back pain. Everyone has low back pain once in their lifetime. So many reasons are there, but one of the main reasons is a sedentary lifestyle. Nowadays we are not moving anywhere, just sitting and using mobiles and computers for so many hours without rest. This habit will cause muscle imbalance in our body. Example: one muscle group becomes tight and the opposite muscle group becomes weak. So, this will cause pain in our body. If we are not taking care in the early stage, it may cause pain in the joints, disc issues, degeneration, etc. Anatomy of the lumbar spine. The reason behind neck and back pain is disc bulge. What is a disc? Disc is present in between the vertebral column of the human spine. It helps to separate the vertebrae from each other. It acts as a shock absorber for the spine. For example, when we are going in the vehicle, our body will shake up and down if we cross some speed breaks. At that time, these discs will help to prevent the vertebrae from touching each other. Disc has two layers. The outer layer is called the annulus fibrosus, inner gel-like structure called the nucleus pulposus. We have 23 discs in the body. In cervical, 6. In thoracic, 12. In lumbar, 5 discs. Common problems in disc are disc degeneration, disc bulge, disc herniation, etc. The nucleus pulposus begins to dehydrate due to aging and it leads to degeneration. The annulus fibrosus also becomes weaker with age and increased risk of tearing. In general, there is no nerve supply to the nucleus pulposus and the inner 2/3 of annulus fibrosus, only nerve supply in the outer third of the annulus. If there is a tear in the annulus fibrosus, the gel-like structure, nucleus pulposus, will come out and hit a nerve. It will cause pain, numbness, paresthesia, etc. Sometimes it spreads to the legs, is called sciatica. On the other hand, during the neck or lower back movement, there is a chance for the disc to come out. If you bend forward, the disc will move backwards. If you bend backwards, the disc will go inside. Common issues in disc are disc degeneration, disc bulge, disc herniation. In severe cases, disc protrusion, extrusion and sequestration possible. We will discuss one by one. Disc degeneration is common. It is due to the aging process. Usually degeneration will start at age 20, and because we will grow till 18 to 20 age, after that degeneration will start. In the neck, degeneration will start at age 18 itself. So according to the age, we all have degeneration in our joints. We cannot escape from degeneration, but we can manage with regular stretching and strengthening exercises. It helps to maintain joint flexibility and strengthen our joints, muscles and bones. Disc bulge. It occurs due to the mechanical pressure when doing peak physical performance. Example: trauma, lifting weights in the wrong way, poor posture, etc. Posterior, backwards, disc bulge is common. It could be forced to lateral. Sidewards, also. So if someone bends forward without bending the knee, there is a chance a disc will come out backwards. It will press the nerve. We can feel pain, numbness, etc. So proper lifting or bending activities we should follow. Disc herniation is called displacement of the disc or slip disc. According to the level of displacement, we can call protrusion, extrusion and sequestration. Majority of the herniation occurs posteriorly or posterolaterally. Research shows that the central herniation occurs 57% of the population. The posterolateral herniation is about 20%. In the lumbar area, lower back, most posterolateral herniation occurs about 75% at L3, L4, L4, L5 levels. Nearly 10% at L2, L3 levels, and 98% of the posterolateral herniation occurs at L4, L5 and L5S1 levels. Studies conducted in 2,000 patients show that 28% of persons have central protrusion, 59% have posterolateral protrusion, and 9% have multiple. The disc protrusion is: the displaced material causes a bulge in the intact wall of the annulus. The disc extrusion is: the disc material is displaced through the ruptured annular wall. The sequestration is: a separated fragment of disc material is forced through the ruptured annular wall into the spinal canal. So the intervertebral disc is a common source of pain. Once research shows that from age 20 to 70, People have 30% to 77% disc bulge without pain. Most pain may be the result of excessive mechanical loads and weakened tissues. Thanks for watching.